Here are some tips for getting the best intraoral photos. When accessing the posterior buccal surfaces, you're going to pull the cheeks wide, but have the patient resist you. As you pull that cheek, you'll have that distance that you need to get the whole tooth surface. On occlusal surfaces, you can go directly on the opposite arch, but if the patient can't open wide enough or you think that they might bite the camera, you can place that camera into the vestibule, rotate it slightly to be able to view the occlusal surfaces. For those maxillary lingual anteriors, rest the camera head on the opposite arch for stability. If you're just free-handing it, it's not going to end up being very clear. For the lingual maxillary posteriors, you can slide that stabilized handle inward and notice my grasp. Depending on where you're at, be sure you always have access to that button so you don't have to find it after the fact. And you can even use two hands here if you need more stability. For the mandibular posteriors, the camera can actually retract the tongue as well. See all those little bubbles on the teeth here? You'll want to dry it or wipe the teeth for the best visibility. For the mandibular anteriors, rest the back of the camera head on those maxillary anteriors. One reason why these images are so clear is because of Mouthwatch's OptiClear sleeves. These OptiClear sleeves come with an optical clear window, meaning that you're going to be able to capture the same high quality images while protecting your camera and the patient. If you just use any cover, it can reduce the quality. Then if you're trying to capture those anterior facials, you might need an extraoral fulcrum and some stability from another hand like so. So follow these tips to get the most clear images on those intraoral photos.